Hi, Tam here. Let's talk about COVID-19, since we're in that context of a COVID-19 pandemic, right? So COVID-19, let's talk, in this episode, I want to talk to you about masks. Should you wear them? Should you not wear them? Are they good for you? Are they not good for you? COVID-19, a fitting subject in this current context, right? Should you wear a mask or shouldn't you? Yeah? Now, there's a lot of information, misinformation and disinformation right now on the internet, on the news, social media and all that stuff. All of a sudden, it looks like half of the world's population is made of medical experts. Everybody is a clinician, a doctor, an epidemiologist, a virologist, a microbiologist. It's unbelievable, right? And it's difficult for those who are non-medical to differentiate between fact and fiction. Now, first of all, you might be asking yourself, sitting in your locked down living room, right, half naked on your sofa there, with a bag of potato chips and a 2-liter Coke, you might be wondering, why the hell should I listen to you? Who are you, man? Well, fair enough, I should introduce myself. My name is Tam. I'm a doctor. I'm a clinician, meaning I don't just sit behind a desk writing protocols and guidelines. No, I actually treat patients every day. I've been a doctor treating patients for the last 17 years and some months. I'm currently working in a private hospital, several private hospitals. When I'm not working in hospital, I do remote medicine. I deploy myself, or rather they deploy me, I'm deploying myself. It's a combination of both. The company I work for deploys me into areas of need, but since I get to choose where I want to go, most of the time I would say I sort of deploy myself, right? I sort of deploy myself in areas of need, and these areas are areas where they really need doctors in the world, right? And so I work there. As well as, when I'm not doing that job, then I work in maritime medicine as a cruise ship doctor, right? So I work on cruise ships, large cruise ships, very big cruise ships. And I also do luxury yachts, luxury super yachts, When I want to catch a break, it's relaxing, So that's my background. So my name is Tam. And so I'm here to serve you today. Authorities in the matter of masks are not unanimous on they don't all have the same message. The medical world right now is polarized in two camps, right? On the one hand, you've got those who are saying that you must wear a mask at all times if you leave your house and find yourself in a closed, confined space. An elevator, a supermarket, a grocery store, like a closed space, a closed room. No matter how big the room is, in the presence of other people, or even if there's nobody else in that room, you should still wear a mask. And that's the majority of doctors who are of that opinion, the majority of people, including myself. I think that's just logical, that's common sense, that's good practice, right? And then, on the other hand, you've got some other doctors, some other organizations such as the WHO, the World Health Organization, and the CDC, the Center for Disease Control and Prevention, who are saying that, look, there's no need for everybody to wear a mask. If you're healthy, only wear a mask if you are in contact with somebody having COVID-19 disease or signs and symptoms of COVID-19. You see, that's a wrong statement, man. I mean, look, right, this is from the WHO. When to use a mask, right? So that's from the WHO website. So the WHO says, this is a communique and notice to the public, right? When to use a mask. For healthy people, wear a mask only, highlighted in yellow, only if you are taking care of a person with suspected 2019 nCoV infection. That was the old name, meaning COVID-19 infection, the SARS-CoV-2 virus infection. You see, I mean, that's a very misleading statement, man. And then the second paragraph, or the line, it's only one line, wear a mask if you are coughing or sneezing. That's good practice. And then masks are effective only when used in combination with frequent hand cleaning, with alcohol-based hand rub or soap and water. Good. If you wear a mask, then you must know how to use it and dispose of it properly. Good. You know, but the first line is a problem. This is a problem. The formulation of this sentence is wrong. Because what you're saying is that if you're healthy and you're not in contact with somebody with suspected 2019 nCoV infection, then you don't need to wear a mask. That's what the WHO is currently saying. That's the stance of the WHO now, today, the 2nd of April, 2020. And that's wrong. And I'll tell you why it's wrong. I mean, first of all, right, only wear a mask if you come into contact with people suspected of having COVID-19 disease. That statement is unclear, ambiguous, confusing. It doesn't make much sense. First of all, if you are healthy, I mean, what does that mean? I'm healthy, I'm not on any chronic medications. So what, is that the definition of being healthy? What if I'm diabetic, but completely controlled? Am I healthy or am I unhealthy because I have a medical condition, right? What if I'm asthmatic? What if I have hypertension and diabetes, but it's all very well controlled? Am I healthy or am I unhealthy? You know, so people will ask those questions and will get confused. What does it mean being healthy? Right? Do you mean somebody with zero comorbidities? I mean, what does it mean? Right? And then, let's assume you are healthy, you're not on any medications, you don't have any chronic medical conditions. The statement continues, if you're healthy, wear a mask only if you come in contact with people suspected of having COVID-19 infections. The majority of people, in fact all people catching the SARS-CoV-2 virus, are not going to catch it today, right now, at this hour, and be symptomatic right now. As with any viral infection, in fact, any infection full stop, there will always be an incubation period. So let's say you catch the coronavirus today. Yes, you might fall sick tonight, but most likely it's going to be an incubation period. I think the average number is 5 days. Right? So it will take 5 days for you to actually fall ill. But it could last from 1 day to 14 days before you get symptoms, before you become symptomatic. You can catch the virus today and tomorrow when you wake up, you're already sick. But it could take 14 days, 2 weeks. And the general consensus is that after 14 days, right, there is no documented cases of patients catching the virus and then 2 weeks, after 2 weeks, getting positive. No. So we say 1 to 14 days with a mean average of 5 days. For that WHO line, for healthy people, wear a mask only if you are taking care of a person you suspected 2019 nCoV infection, meaning COVID-19 infection. I respect the WHO. I'm a member of the WHO, but that line is ridiculous, right? Now, so that's point number 1, right? You have to wear a mask regardless of you getting exposed with a confirmed case or somebody who has symptoms resembling the disease. It doesn't matter. When you leave your house, wear a mask. Because there's plenty of people walking around who have the disease, who have the virus, but are asymptomatic. And that's common sense. So please, WHO, CDC, come right. Change your little guideline there. Number 2, most people believe that the SARS-CoV-2 virus is not airborne. And again, some well-respected organizations are still maintaining today, April the 2nd, 2020, that the coronavirus, this current coronavirus, is not airborne, meaning when somebody coughs droplets into the air, these droplets will just fall down and deposit on surfaces, right? Whatever surface is there, a table, the floor, a chair, whatever. But in the New England Journal of Medicine, on the 17th of March, 2020, 2 weeks ago, a correspondence was published as a letter to the editor. That correspondence presents the results of a research done on SARS-CoV-2, the current coronavirus, and SARS-CoV-1, the coronavirus responsible for the last epidemic, right? And it analyzes, right, the half-lives of these two viruses on surfaces, like metallic surfaces, plastics, cardboard, and more importantly, whether the SARS-CoV-2 virus, this current coronavirus, is airborne, meaning can it stay alive and suspended in the air after somebody sneezes or coughs. What the study shows, right, from this publication, from this correspondence from the 17th of March 2020, 2 weeks ago, it shows that SARS-CoV-2 is in fact airborne. When I say airborne, it doesn't mean that, it's in the air and it's flying around the entire world, and if you just leave your house and you breathe in, you're done. Or if you open your window, you're kaput. No. No. But it means that, when somebody coughs in a closed space or in a confined space, you know, like an elevator. The coronavirus will stay suspended in the air, viable for at least 3 hours. I mean, that's something very important, man. So it means that, you know what? You go out there, you're not wearing a mask, you're following the WHO and CDC guidelines, right? So you're healthy and there's nobody around with symptoms of COVID-19. So you're not wearing any masks. You're not wearing any masks. You press for an elevator, the elevator comes, opens, you get in, closed, you breathe in there, but you don't know who was in that elevator before. So let's say that 3 hours ago, or 2 hours ago, somebody who's COVID-19 positive was in that elevator, coughing and sneezing all over the show, right? All those droplets of, all those coronavirus-filled droplets in the air, in that elevator, right? The virus is going to stay suspended in there, viable, for at least 3 hours. So you come 2 hours later after this person has left, with no masks, and you're breathing in there, you are infecting yourself. So what I'm saying is that, unfortunately, it appears that based on this new correspondence from the 17th of March in the New England Journal of Medicine, the recommendations then of the WHO and the CDC regarding wearing masks are wrong. You have to wear a mask. But maybe not in the air if you're walking on the streets, going to buy going to your grocery store, right? Or you just in your garden outside, or your balcony. No, I mean, you know, it's not airborne in that sense, like I just said, but definitely, you know, when you go into closed spaces, confined spaces, you know, protect yourself. Any closed space, wear a mask. You know, be safe. But my second point on mask is that regardless of these recommendations, right? You don't know, we don't know, I don't know if today I'm COVID-19 positive. Of course, I can't test myself every single day. It doesn't make sense. You never know, man. You never know. I could be positive. So what I'm saying is, protect others as well. So I don't know why the WHO and the CDC are saying that. Well, you know, it's important to protect others as well. So wear a mask all the time to protect others, right? I must wear a mask, we must wear masks to protect others as well. I thought that was common sense, man. So yeah, that's my message to you. Don't take chances, protect yourself, but also protect others. So wear a mask at all time. And it doesn't have to be a mask like an official mask, pharmaceutical mask. If you're wearing a cloth mask, you are already protecting yourself. That is better than no protection. Plus, if you are positive but you don't know, you're protecting others. Protect yourself. Protect others. Wear a mask.